Hello everybody, my name is Rachelle and it is June Awareness Month, which means it's time to shine a light on Mal de Debarquement Syndrome. And I have taken a personal mission in raising awareness for this rare neurological condition because I am one of the few that suffer from it. This has been my journey since January of this year, and it has affected me in such a profound way that I have made it my personal mission to raise as much awareness for this devastating syndrome as I can. So thank you for watching this video. I hope that it educates you and inspires you to raise awareness and also to perhaps donate to the foundation to raise funds. And if you are a medical provider, specifically any type of medical provider, but specifically a neurologist, maybe it'll inspire you to find a cure for us rockers. So Mal de Debarquement Syndrome actually translates to sickness of disembarkment, and it is not a very well understood condition. What is understood about it is that it lies within the brain, and it's an inability to readapt to movement once it has stopped. It's an exposure to unfamiliar movement and then the sudden removal of that movement. The illusion of movement felt as an after effect of travel by ship, aircraft, automobile, train, ship, or by novel movement patterns. The illusion of movement begins immediately after cessation of precipitating events. Although there are other types of mal de debarquement, I have heard stories of people that have been under anesthesia and have woken up like this. I have heard of people taking a medication and have it triggering mal de debarquement. I've heard of people just, there's no rhyme or reason why, and just out of the blue this has occurred. That's called spontaneous mal de debarquement syndrome. Normally, after exposure to unfamiliar movement and the cessation of it, it's fairly normal for people to have this illusion of movement, but it usually will pass within 24 hours. And that's rather common. However, for the very rare few of us, it hangs around for a while longer. This is called persistent mal de debarquement, and this lasts anywhere from 1 to 12 months. Anything lasting longer than 12 months and you not reaching remission, the harder it is to reach remission after that. And then you can go back into another episode after remission once you have had this. So my personal journey with mal de debarquement syndrome started, like I said, in January. I went on my first 3-day cruise with my girlfriends. I put on my party hat. I had a wonderful time. I had no issues on the boat until the very last day. I got violently ill, and then once I debarked the ship, my life was never the same. I actually felt, the minute I stepped off the boat, a strong gravitational pulling within my head, and I thought I had vertigo, post-cruise vertigo, and that lasted for about 6 days. I self-treated at home. Being an emergency room nurse, I knew exactly what I needed to do for vertigo, so I treated with meclizine, B6, ginger, Zofran, and C-bands. And after about 6 days of no relief, I also did Epley maneuver, and I even did a couple of other maneuvers as well. And after 6 days of no relief, I took myself into my hospital that I work at, since I trust my docs with my life. They admitted me. I had a brain MRI, which was normal. I had an abnormal PT evaluation, which immediately got the wheels turning for an outpatient neuro rehabilitation, which I have been in since January. I was referred to see an ear, nose, and throat doctor. They did VNG testing, which only showed hyperactive labyrinthine. They told me I either had vestibular neuritis or I had Mal de Debarquement Syndrome. So they treated me for vestibular neuritis, but with valcyclovir. That did not turn up with any relief, so it was obvious I had Mal de Debarquement Syndrome. So they referred me to neurology, since it is not technically an ear structural issue, it's a brain issue. The neurologist only wanted to treat me for my headaches. So I found another ear, nose, and throat doctor that is familiar with Mal de Debarquement and does treat patients with Mal de Debarquement. So he has resumed my care along with my physical therapist. So in combination with the both of them, they have gotten me this far. I've come a long way since January. I am a lot better than I was. I still have a long way to go. I'm currently on Klonopin, which is a benzodiazepine. That is a pretty common approach amongst doctors for the treatment of Mal de Debarquement Syndrome at this time. I'm also on Topamax, and then I have just started a calcium channel blocker, which is verapamil. It's actually a blood pressure medication. I do not have blood pressure issues, but it has an off-label use for light and sound sensitivity, because those are major triggers for me. So that is kind of my personal journey with Mal de Debarquement and how I was diagnosed. I'm one of the very lucky few that got a quick diagnosis that did not get written off for several months or several years. So I find myself very, very fortunate that I got a diagnosis and I got treatment very, very quickly, because that is not the case for many people. So my symptoms, I'm going to talk about my symptoms and my triggers very quickly. They do come into alignment with a lot of people's, other warriors, Mal de Debarquement warriors, but we are all very individual in our symptoms and our triggers. We use a 1 to 10 scale, and they vary day to day, hour by hour. I can be a 2 or a 3 at one moment, and then an hour later I can be up to a 10. It really just depends on my triggers, and there is really no rhyme or reason for how I wish I knew, because if I knew, I would be at a 0 all the time. So my symptoms are external rocking, bobbing, and swaying, pulling, a gravitational pulling. It's a feeling. I get a feeling, internal feeling, like I am on a high-speed elevator or a moving sidewalk, you know, the ones that they have at the airports. A sinking feeling, a vibrating, a quaking, a tingling, and it's not like a paresthesia, like like your hands or feet are falling asleep. It's like a tingling that I get in my brain, almost like when you get electrocuted, like you get that type of tingling feeling, and then it will spread throughout my body. Detachment, I can't explain it, but when you walk, you're not feeling the ground beneath your feet, and a detachment from just the world around you. I guess that would go hand in hand with the brain fog. Head pressure, fullness. A lot of people will explain it as like a balloon that is being blown up from within your head. Sharp stabbing pain in your head, in your ears, ear ringing, headaches, brain fog, memory loss, word finding, word replacing. Good example of this, I find it funny. I actually want to keep a journal of all the stupid things that I say and do because they're hilarious. But I was trying to say ear plugs, and instead I said ear goggles. Fatigue. I'm exhausted all the time. It doesn't matter if I slept all night or not. Depression. I mean, who wouldn't be depressed, right? Anxiety, panic attacks, visual changes, double vision, blurry vision, changes in my peripheral vision and depth perception. I walk into door frames multiple times a day. I walk into chairs and all kinds of things. I'm covered in pretty little bruises all the time. My triggers. Fluorescent lights are my kryptonite. You pair that with a long hallway and you got yourself a sack of potatoes. LED lights, especially the bright ones, I do really well with. Just a soft yellow lighting is the best for me. Loud sounds, especially if you get several different loud sounds going at the same time. Too many people or objects moving around me. The ocean surf, small spaces, my closet, haven't put my laundry away since January. Long hallways, sweeping and mopping and folding laundry, even the elevation changes from trying to transfer laundry from the washer to the dryer. Trying to focus and concentrate. That's why I'm reading off of a whiteboard and note cards, because if I didn't, this would not make any sense to you guys whatsoever. Laying on pool floaties. Stress is a big one. It's almost instant. If I get stressed out, I will go from a 2 to a 10. I will not be able to walk or to talk if I am stressed out. Weather changes, barometric changes, same thing. I should be a weather lady. If I can't return to nursing, I will be the most reliable weather woman in Florida. Nominate Rachelle as the most reliable weather woman in Florida, because I can feel a storm coming in within like 5 minutes. So probably not the most reliable, but reliable within 5 minutes. My menstrual cycle, TMI, I know, but it is guaranteed that the week of my cycle is going to be a bad week for me. Electronics and Wi-Fi definitely make my symptoms worse. Flashy movies, or a lot of movies with quick camera angle changes, and then doing too much with my hands, or other people doing too much with their hands, like those hand talkers. I'm a hand talker, so I try not to do that to myself, and I ask people that know, that are friends with us warriors, to put your hands behind your back when you're trying to talk to us. Anyways, that's all that I have for you. Thank you for taking the time to listen, and bless you. Please share to spread awareness and shine a light on this crazy disorder, and help us raise awareness for just how rare this is, and help us get the word out there, so that way this isn't this is a household name, and that more people are informed before they make certain decisions. Bless you guys.